All right. Hi, everybody. I am going to be demonstrating the final exam on Dan today. So, hi, Dan. My name is Shanti. I'm a nurse practitioner. I'm going to do a physical exam on you. I'm going to go ahead and do some hand hygiene here, so hand sanitizer. I will be explaining things as we go throughout. Please let me know if you have questions, concerns, anything comes up for you as I'm doing it. So first we're going to talk about your vital signs here. So blood pressure 120 over 80, pulse 77, respirations 13 per minute, pulse oximetry 99%, temperature 98.9, you're 6'2", 240 pounds. So all of that looks normal. Well done. All right, and as we go through, I'm going to be looking at your general appearance, emotional state, noting his dress, looking at skin, turgor, color, any scars, hair distribution. So looking at all of that generally, and as I go throughout the exam, I will be continuing to do that as I see new parts of skin. So far everything normal. I'm going to go ahead and look at his head first. So looking at hair distribution, at his scalp, facial symmetry, skin on his face, all of that looks normal. Do you wear glasses, contacts? No, okay. So I'm going to take my eye chart here, holding it about 14 inches from him, and go ahead and read the lowest line that you can read clearly.
LTFPH.
Okay, perfect. So that's 20/20 vision. Beautiful. And I'm going to look at your conjunctiva here. So go ahead and look up for me. Good. And look down. All right, lovely. And I'm going to palpate your lacrimal glands here. Any tenderness in there? No. Beautiful. Okay. I'm going to look at the corneal light reflex here. So first, just looking straight at the light here, and I'm looking at the light reflex in his pupils, looking that it's symmetrical, that looks normal, and then go ahead and look straight at me, and I'm going to look at your pupil reaction to the light, and then look for the other side as I'm doing that. Okay, and look at the other side. Beautiful, so it's normal. And then I'm going to look at extraocular movements here. So go ahead and follow my finger with your eyes, but keep your head still. Here, and you want to go relatively slowly with this, so you're not making people dizzy. Good. Back in. And looking at this as cardinal directions. And then in. Beautiful. And I'm going to then look at your pupil response to accommodation. So go ahead and look at the wall behind me, and then look at my finger. Good, and then again back to the wall. Okay, beautiful. I'm looking at visual field. So cover your right eye for me, and let me know when you can see my fingers. Okay, same thing here. Good. And you should be actually looking straight ahead at me, like this, straight. Okay. Okay, and then the other eye. All right, and then I'm going to do the fundoscopic exam. So I have my ophthalmoscope here, and I'm going to move in a little bit closer, and I'm going to first look at the red reflex on both sides. So go ahead and just look straight at me. Okay, I'm seeing it there, and then look straight at the wall over here, please. And I'm going to come in from the side here, and around to about 15 degrees, and going in, adjusting as I need to, and looking at the optic disc, the arteries and veins, the retina. Okay, good. Same thing over here. So go ahead and just look straight ahead, and I'm using my left eye on his left eye, coming in from the side, and rotating around, and optic disc, seeing that clearly, veins and arteries. Beautiful. Okay, that all looks normal. All right, and moving on to the ears. So first just doing a whisper test. So I'm going to stand behind you, whisper something, let me know what you hear, okay? 77.
77? 13.
Beautiful. Okay, and then I don't have a tuning fork, but this will be my tuning fork. I'm doing the Renee test, so I'm looking for bony versus air conduction. So I'm going to place this here on the mastoid. Go ahead and let me know when you can't hear it anymore.
It's gone.
Okay, and then bring it around to the ear.
I still hear it.
Beautiful. Same thing over here.
It's gone.
Beautiful. Okay, and then the Weber test. So I'm going to put it on the top of your head. Let me know if you hear it equally in both sides. Okay.
I do.
Beautiful. Okay. And then just looking at the external ear, let me know if you have any tenderness where I'm palpating here. Anything? No? Okay. And I'm going to look with my otoscope. Okay. And pulling his ear up. Okay. And I'm seeing the tympanic membrane. It's pearly. Seeing the malleus, cone of light. That looks normal. Same thing over here. Any tenderness?
No.
Okay, and looking in. Okay, same thing. I'm seeing a pearly tympanic membrane, malleus, cone of light. Okay, the canals on both sides look normal. Okay, nose and sinuses. Any trouble smelling recently or any changes in smell? No? Okay. Go ahead and close one nostril for me and breathe in. Any issues there? And then switch sides. Any issues there? No? Okay. Great. And I'm going to use my otoscope with a clean speculum here, and I'm going to have you tilt up a little bit. And I'm looking in each nostril. Okay, that looks normal. I'm looking for any swelling, redness, significant exudate. And then I'm going to palpate your sinuses. So let me know if it hurts anywhere or is tender anywhere I'm pressing. Okay. Maxillary sinuses here. Anything there? And frontal. Beautiful. Okay. All right. So moving on to the mouth. Any change in taste recently? You're tasting weird things? No. Okay. So go ahead and open your mouth for me. And I'm just generally looking at the mucous membranes, at the soft palate, hard palate, and I'm going to take my tongue blade here, a little sleepy, all right, and go ahead and say ah for me, looking at the uvula rise, and put your tongue up at the roof of your mouth, looking at the underside of the tongue, also looking at dentition as I'm going through there. That all looks normal. Then I'm going to take my glove and I'm going to palpate the lips and the mouth. So looking for any masses that I wouldn't necessarily see. Let me know if it hurts anywhere I'm touching here. Feeling in the cheeks. Okay. And tongue. Go ahead and stick your tongue out for me. Not feeling anything abnormal there. And go ahead and push your tongue against my hand here. Okay. Great. Same thing over here. Okay. And then clench your jaw. And I'm just feeling the muscles here. Okay. And relax. And go ahead and open and close your mouth. Listening for any open and close your mouth. Continue to open and close your mouth. Watching for any pops, clicks, no TMJ there. Beautiful. And then go ahead and smile for me. Okay, thank you. Frown. Puff out your cheeks. Good. Raise your eyebrows. Okay, relax. Close your eyes tight as you can. Don't let me open them. Beautiful. And then you can open them. Press your head against my hand. Okay, same thing over here. And shrug your shoulders up against my hands. Okay, great. All right, and we've gotten through that. So we're going to look at range of motion of your neck. Go ahead and put your chin down to your chest for me, and then look up at the ceiling. Good. Let me know if it hurts anywhere when you're doing this. And then rotate side to side. Okay, and then tilt side to side. Okay, great. And then I'm going to palpate the lymph nodes. So looking at the pre-auricular lymph nodes, post-auricular, tonsillar, submandibular, submental, anterior cervical, deep anterior cervical, supraclavicular, posterior cervical, and occipital here. Okay, I'm not feeling anything abnormal there. All right. And then looking at the anterior neck, looking for the trachea, its midline. That all looks normal. And I'm going to palpate your thyroid here. So I stand behind you with my hands around your neck. Can be kind of uncomfortable, but let me know if you need me to stop. And just palpating here. Go ahead and swallow for me. Okay. And then palpating the isthmus here. And pushing gently to one side, palpating the left lobe, the right lobe. Okay, I'm not feeling any masses or any swelling, so that's all normal. Okay, so moving on to the chest, would you mind removing your shirt for me and actually facing the other way if you don't mind? Beautiful. And just make sure this is good. Okay. So I'm first just looking at the skin, at the chest expansion generally, looking at the quality of his breathing. It all looks normal so far. I'm going to start with tactile fremitus, so go ahead and say 99 for me.
99.
Beautiful. Again.
99.
Again.
99.
Okay, and again.
99.
Okay, so I'm feeling vibration in both hands equally, bilaterally. And I'm going to palpate the spine, so let me know if you're feeling any tenderness as I'm going down. I'm looking for any areas of swelling, asymmetry. That all feels normal. All right. I am going to palpate the diaphragmatic excursion, or percuss. So first I'm going to percuss down in a ladder pattern. Okay. And then go ahead and take a deep breath in for me and let it all out. Okay. And I'm percussing for dullness. So I'm hearing it about right there. Go ahead and breathe in. So I'm estimating here, I hear resonance, and it gets dull about there. So there's about 4 centimeters of excursion. And then I'm going to auscultate. So again, in a ladder pattern with the diaphragm of my stethoscope. Breathe in for me, in and out through your mouth. Again. 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 Okay, great. Go ahead and turn around for me. Thank you. And I'm just going to listen anteriorly. Deep breath in and out through your mouth. Okay. All right, so moving on to the cardiovascular exam, I'm going to have you lie down for this. And ideally, you want your patient to be at about 30 degrees. So first, I'm just looking tangentially for any lifts, heaves, thrills, and I'm not seeing anything visibly. Also looking at the skin, looking for any scarring, any evidence of trauma or surgeries. And I am just going to change the angle here a little bit so you can see better. All right, and I'm going to palpate for any thrills, lifts, or heaves, and I'm doing that with the palm of my hand here, the second right intercostal space, left second intercostal space, down at the left sternal border, at the epigastric area, and at the apex. Not feeling anything abnormal. And then I'm going to palpate the carotid arteries here. So one side at a time, so I'm not cutting off blood flow to the head. Okay, and I'm going to listen with the bell of my stethoscope. Okay, and I didn't find the PMI earlier, so I'll do that now. Okay, and feeling more generally and narrowing in. You can have the patient lie on their left side to do this better. It's about the size of my middle finger pad here. So that's normal. And then I'm going to auscultate with the diaphragm of my stethoscope. I'm going to listen to the second intercostal space here. So it's the aorta. Sorry, I was on the right side. Now I'm on the left side listening to the pulmonic at the left second intercostal space, at the sternal border, moving down, still on the left side of the sternum, fourth intercostal space in the tricuspid area listening, and then listening in the mitral area, the apex. Okay, and then I'm going to listen with the bell of my stethoscope in the tricuspid area here, and again at the apex. Same for S3, S4 here. It's better heard with the bell. Okay. And I am going to auscultate the abdominal aorta, also with the bell. Okay. And the renal arteries. And iliac. Okay. And then palpate the femoral artery here on both sides. And then listen with the bell of my stethoscope. Okay. So that all sounds normal. I'm going to move on to the abdomen here. So I am going to auscultate again with the diaphragm of my stethoscope for vowel tones. Okay. Good. And just looking at the abdomen tangentially, not noticing any distension, any masses. I'm going to palpate, light palpation first. Let me know if there's any tenderness anywhere I'm pressing, okay? Okay. Good, and then deeper palpation. Okay, good. And I'm going to palpate the liver here, so take a deep breath in for me, and then let it out. And another breath in, feeling the border of the liver here. And then same thing over here, deep breath in and out. And one more breath in, feeling for the spleen, but I'm not feeling anything. Good. Okay, I'm going to have you sit up for me. And moving on to the musculoskeletal system, so I'm going to start with just range of motion of your arms. So go ahead and raise your arms up above your head. Perfect. And then down like so. Good. And out around, back behind you. Beautiful. Hold your arms up like this for me and go ahead and press out, checking the strength of the triceps. Pull back, bicep strength here. And go ahead and squeeze my fingers as tight as you can. There's grip strength. Great. And I'm looking at your hands, fingernails, looking at the coloration of the skin, and looking for any swelling anywhere. I'm going to palpate the joints. Let me know if it's tender anywhere. Good. Okay, that all looks and feels normal. Same thing over here. Good. And palpating the wrists, same thing. Let me know if you have any tenderness. And the elbows. Okay. Good. And palpating the shoulders. And the glenohumeral joint here. Okay, same thing on the other side. Shoulders. And again, if the patient was coming in with a specific complaint, I would do a more focused exam, musculoskeletal wise and otherwise. All right. So moving on to the lower extremities, any general weakness or tenderness in your legs?
Mm-mm.
No? Okay. Go ahead and lie back for me again. And I will rearrange that. All right, so just starting with tenderness in the hips. And you can actually, well, your legs are too long to bend them on the table, but if they weren't, I would have the client bend his knees up. It's too angular. It's fine. So I'm just palpating the hips here. Let me know if there's any tenderness anywhere I'm feeling. Okay. Same thing on this side. Okay. And the knees. Not feeling anything abnormal. Okay, I'm going to check the popliteal pulse while I'm here. And same thing here. Any tenderness anywhere? No. Popliteal pulse. Okay, good. And then I'm going to check range of motion here. So I'm checking flexion and flexion of the hip and knee, extension, and then back in, external rotation, internal rotation. Good. Any pain while I'm doing that? No. Okay, same thing on the other side. Flexion here, extension, and external rotation, internal rotation. Good. All right, you can go ahead and sit up, and I'm going to test quad strength with him sitting this time. So go ahead and just press your leg up against me. Beautiful. Same thing over here. Great. And press. I'm going to rearrange actually first. Okay, go ahead and press out against my hands. Good, and pull back towards you. Perfect. Press down against my hand and pull up. So checking plantar flexion, dorsal flexion. Up. Beautiful. All right, and I want to do range of motion of the ankle as well. So let me know if any tenderness while I'm doing any of this. All good. Same thing over here. Great. All right, and then pulses, I already checked the popliteal pulse. I'm going to check the dorsalis pedis pulse bilaterally. Good. Okay. And then the posterior tibial. Okay. All right, so moving on to the neurological exam. Change the angle yet again, and we're going to look at graphesthesia. So I'm going to draw a number in your hand. Let me know what number I draw. Please close your eyes.
1,
Okay, same thing over here.
3,
Great. And I'm going to put 2 objects in your hand. Let me know what you feel.
it's a quarter,
Okay, same thing over here.
paper clip.
Great. And then I'm going to check reflexes. So again, I don't have a reflex hammer with me. This doesn't work well, but I can somewhat demonstrate it. So go ahead and just relax as much as you can. Okay, triceps and flop into my hand here. Getting the biceps tendon here. Okay, and the brachioradialis. Okay, same thing on the other side. Triceps, go ahead and just flop. Okay, and biceps. And brachioradialis. Okay, good. And then the plantar, sorry, the patellar tendon. Oh, you can't see me. Here we go. Moving down. Okay, same thing over here. And the Achilles. And Babinski. Okay, good. Good. All right. Last part of the exam here, I'm going to have you stand up. And then just looking at how you're walking. So go ahead and walk away from me, just how you normally would walk, and then walk back to me on your toes. Good. And walk away from me on your heels. Great. And walk back heel to toe. Okay, great. And then come back in the view of the camera if you don't mind and do 3 knee bends. Okay, lovely. And I'm just going to have you stand there with your hands down by your sides and close your eyes. You've done this before, and I'll catch you if you lose your balance. Okay, I'm doing the Romberg test here. Okay, perfect. All right, last part, I am going to check the range of motion of your back. So go ahead and lean forward, touch your toes, and just looking at the curvature of the spine. Great, you can stand up and turn around and lean back for me, looking at extension. Okay, and then back to neutral, and you can go ahead and rotate side to side. Great, and then tilt side to side. Okay, great. I think that is it. So I'm going to go ahead and stop this, and I'll see you in class.